When caring for a patient with hemophilia experiencing severe pain and swelling in the knee, likely due to hemarthrosis, the nurse should prioritize the following actions addressing the bleeding, minimizing joint damage, and ensuring patient safety and comfort. 1. Administer factor VIII replacement therapy as prescribed. The underlying cause of the swelling and pain is bleeding into the joint. Administering factor VIII helps restore clotting ability and stops the bleeding. This is the most critical intervention to prevent further joint damage and alleviate symptoms. 2. Elevate and immobilize the affected joint. Mobilization reduces movement, helping to minimize pain and prevent further bleeding into the joint. Elevation can also decrease swelling by promoting venous return. 3. Apply ice packs to the knee. Ice helps reduce swelling and slows bleeding by causing vasoconstriction. Ensure the ice is wrapped in a cloth to avoid skin damage. 4. Administer pain medication as prescribed. Severe pain is a common symptom of hemarthrosis. Administering pain relief, typically acetaminophen, helps improve patient comfort. Avoid NSAIDs like ibuprofen or aspirin, as these can worsen bleeding tendencies. 5. Monitor neurovascular status of the affected limb. Assess for signs of compromised circulation or nerve function, such as pallor, diminished pulses, or numbness/tingling, which could indicate increased pressure within the joint or compartment syndrome. Immediate intervention may be required if these signs develop. 6. Educate the patient about joint rest and factor VIII therapy. Explain the importance of resting the joint to allow proper healing and the role of factor replacement therapy in preventing recurrent bleeds. Avoid heat therapy. This can increase blood flow and worsen bleeding. Aggressive joint movement. Until bleeding has resolved, movement should be minimized to avoid exacerbating the bleed. Rice Plus for joint bleeds with hemophilia. A mnemonic incorporates standard care for joint bleeds with hemophilia-specific considerations. R. Rest. Avoid movement of the affected joint to prevent further bleeding. Encourage immobilization to reduce strain. I. Ice. Apply ice packs, wrapped in a cloth, to reduce swelling and vasoconstrict blood vessels, minimizing further bleeding. C. Compression. Gently wrap the joint with a bandage if prescribed, ensuring not to compromise circulation. E. Elevation. Keep the joint elevated above heart level to reduce swelling. P. Pain management. Use prescribed pain relief, e.g., acetaminophen. Avoid NSAIDs or aspirin as they worsen bleeding tendencies. L. Limit movement. Encourage non-weight bearing and joint rest until bleeding stops and swelling subsides. U. Use factor replacement. Administer clotting factor, e.g., factor VIII for hemophilia A, promptly to stop the bleeding and promote recovery. S. Support with physical therapy. Once the acute phase resolves, introduce gentle physical therapy to regain strength, mobility, and joint function. Avoid overloading the joint.